Welcome to Health Insurance Doesn't Have to Suck. I'm your host, Brian Calvert. For those that have previously listened, thank you, and please feel free to subscribe so you don't miss out on future episodes. For those of you that haven't, I'll remind you that this is a short, focused podcast designed to make health insurance easier to understand. In the last episode, we talked about the core terms that make up every health insurance plan and how they work together. Today, I want to talk about something people don't really need explained, and that's because they feel it every year. That's why premiums continue to go up. And the frustrating part is it often feels random, but it's not. Premium increases are a reflection of what's happening underneath the plan. So there's a reaction to what's happening inside the system. And once you see that, it starts to make a little more sense. So there are a lot of ways people try to explain rising premiums, and most of them, they kind of stay at the surface. And I want to go a little deeper. But at the core, it really comes down to a few key drivers. And if you understand those drivers, you stop reacting to price and you start understanding what's really moving it along the way. So there's really three main drivers behind premium increases. The first is utilization. Simply put, people are using more care, more doctor visits, more procedures, more follow-ups, and sometimes that is because the care was delayed and now they're catching up. Or there's plenty of other reasons why people stop going to the doctor. But when more care is used, the total cost goes up. Pretty simple concept. The second driver is cost per service. So now it's not just more care, it's more expensive care. And this is something we've seen and heard in the news and talked about all over. Everyone knows that inflation has hit pretty hard. Hospital costs cost more. Specialist visits cost more. Surgical procedures cost more. Everything's just gotten more expensive. And healthcare inflation doesn't always fall to normal inflation. In many cases, it grows even faster. The third driver is the risk pool. So insurance works by spreading risk across a group of people. That's something we talked about in the first episode. So the smaller or less stable that group of people is, the more sensitive the pricing becomes. So when that balance changes, pricing follows. So if a group becomes less healthy overall, or higher claims enter the pool, the cost to insure that group increases. And this is where things can start to really feel unfair. You might not have used your plan much at all, and your premium still goes up. And I've had clients tell me, hey, Brian, we barely used the plan this year. How come it's going up 15%? And from their perspective, they're right. But when we zoom out and take a look at the entire group, it only takes a few large claims to change the cost of the total cost of the plan. And the same concept applies to the individual side too. It's just a different pool of people. So now, depending on where you get your coverage, whether that's through an employer or through the marketplace or a private plan, those increases can show up a little differently. But underneath it all, the drivers are all the same. And there's one other factor we haven't really talked about, and that's pharmacy costs, especially specialty drugs. These are high-cost medications used to treat complex conditions. And while they can be incredibly effective for so many different things, they can also be very expensive. And that category that's probably gotten the most talked about or the most traction attention recently is the GLP-1 medications. These are your Ozempics, Mounjaro, Zepbound, all those sort of things. They're used for diabetes and they're used for weight management. And what makes them unique is just how effective they can be. They're proven to work for those things, plus sleep apnea and addiction and all kinds of stuff. It's great. But they really can impact a plan very quickly. So we're going to spend some time in future episode talking about pharmacy just to make sure we understand that. But from now, just remember a small number of prescriptions can make up a large portion of total claims. And that impacts the overall plan costs. So when you put all this together, utilization, cost per service, risk pool changes, and pharmacy, you start to see something important. Premiums aren't random. They're just a reaction. They reflect how the system is behaving underneath. So let me give you an example. A small business may have 5 employees, and they had coverage that worked for them. Even though the costs were a little high, it worked for their company and their families. But during the year, they had a couple employees that had a few complex medical issues. There were some specialty meds and maybe even a surgery. So when the renewal came down, maybe their costs went up 18%, 15%. When you look at it through that lens, it's not surprising they went up. The claims happened. Now we have risks that are known, maybe some complex medical issues, and there's a track record. So the pricing adjusts. Now, it doesn't feel great, but at least it's explainable. And a lot of times, just understanding why is half the battle. So once you see that, you stop asking, why did this go up? You start asking, what actually is driving this and how can I help or fix that or work within that area? So that's a much more useful question, especially as a business owner. When you understand what's driving it, it kind of takes maybe some of the emotion out of it. And that's also why simply shopping for a lower premium doesn't always solve the problem, because premium's only one small part of the picture. So what really matters is the structure behind it and how the risk is being handled. So that's exactly what we're going to build on next. On the next episode, we're going to talk about why deductibles have gotten so high and what that actually means for how you choose a plan. So if you find these conversations helpful, make sure you follow the show so you don't miss what's coming next. And if you know someone who finds health insurance confusing, please feel free to share this episode with them. I also write a short companion newsletter called Clarity Notes, where I expand on these ideas in a slightly different way. Thanks for joining me. I'm Brian Calvert, and we'll keep building clarity from here.